And since many of the faculty are part of this FTP is on AI in medical imaging and diagnostic, one thing that wanted to emphasize is this is rightly named as, so you could see in the name both AI and medical imaging and diagnostics in the medical imaging is there. So one cannot replace any time the other. So they should go hand in hand. You take, for that matter, you take any application. It is true with any application in general, and in particular also in medical imaging, if one wants to work in this area, one should have a sound understanding and knowledge of both AI as well as medical imaging. So this session for the next 1 hour mainly focuses on giving some idea about the domain knowledge, or give you some domain knowledge about the medical imaging modalities. So before that, we will start with this question. In the first place, why do we need medical imaging? I'm not sure if the microphones are on because of the number of participants. If they are muted, I guess. So you can think yourself a moment on what is the role of this imaging, medical imaging, and why do we need that? What would have been the scenario if we do not have medical imaging? So this picture by a very famous painter from Dutch Republic shows how this situation used to be. This was in 1600s, so 17th century. The only way people are able to see and what happens inside the body is through postmortem. So that's the only way, or by opening the body. So nowadays, and this picture, the way all the people are looking at it, might look like a bit of an exaggeration for us in the first look, but this is a real picture around before 20th century, how all the doctors used to learn, know, diagnose, treat everything. The only way for them is to cut it, to cut the body open and see what's going on there. So imagine, for example, if somebody has met with an accident, and let's say the is the car, the leg got twisted, let's say. The only way whether there is a fracture or not, other than symptoms, there is no way earlier other than imaging part. Same is the case if there is nowadays, if there is a cancer inside it, you know it by imaging part. If there is an infection inside lungs, know it nowadays by imaging. If there is some kind of fluid got accumulated in any of the parts of the body, you know it by imaging. So this luxury, this is a luxury compared to what we had before 20th century, was not there earlier, and that's where we are very fortunate. And nowadays, the automated computer aided diagnosis based on this developing is very important and profound area to look at. So if we have to say, so the answer to that question with which we started is, why do we need medical imaging, is to see inside the body in a way that are less invasive or completely non-invasive. So if you look at those earlier incidents, the only way is very invasive. They need to open things and see it. So that's not the only thing. Now we not only see a structural information now through the images, we could see metabolic information, we can know functional information, molecular activities, which even by through opening one cannot, is not visible to the naked eye, now can be seen with the medical imaging. So this is, hope this makes you clear on why medical imaging is so important. And just to give you a glimpse of how advanced things have went through, let's say, last 1 century, you could, this is one example of an MRI scan acquired in 2019 at MGH Hospital in Boston. So the accuracy, the fineness with which this MR image is acquired is at 1 mm resolution. So this is this was not imagined earlier that one could reach to these levels of resolutions. Of course, the typical MR imaging won't contain such a high resolution, but this that that's already a very good resolution. Usually, you could expect something around the order of by in the resolution that you could expect in the typical ones. But these are really good, accurate, good resolutions we are able to achieve with the current state of the art MR machines that we have, and of course with CT as well. That has, I think, here even could get up to zero point 0.1 in very typical machines, and can be up to 1 in CT machines and all. So now the next now we answered or try to see why this is important is what we have seen. But now the next logical question would be, how do you get images? So what is the base, what is the phenomena involved in acquiring the images? So yeah, well, we as humans have an imaging system here. That's why we are all looking at the slides there. Now we are looking at the surroundings here. So how does this imaging work? If we understand, that helps us to even understand, that gives us a beginning point on how medical imaging works. So you could see here, for example, how we are seeing images. There is a source of light. That light has fallen on some object and getting reflected and falling on our eye, on the retina of our eye, and at the back of our mind, of our brain, it's formulating the image. On that sensors are there, and that's where the image is reconstructed at the back of the brain. The sensors and everything is there on the back of our eyeball, right? So the retina part, and that's how we are seeing it. So you could say that reflection, there is a source. The source here for us is light. To be more precise, what nature of what kind of light are we looking at here? Is visible light, correct? And based on the principle of reflectivity, based on the principle of reflection, we are looking at it. Now the next question could be, is reflection the only way we look at images? Not necessarily. Suppose I could take a glass of water or put something inside that. I could put the source on one side, and from the other side also I could see it. Now this is not through the principle of reflection. Now whichever got transmitted through that glass of water or whatever liquid or object I have taken inside, fluid I have taken, I'm looking at, it is through principle of the whichever is there remained at the other end, I'm able to see that. So this is through principle, I can say through the principle of transmission. So whichever got transmitted is seen. Again, we could say through refraction, whichever got refracted, that also I can see. And these are two very, one is, I'm now, if you look at it, through reflection, through transmission. So are they the only ways, or is there any other way? Say, for example, there could be, you might have seen where in these two cases, the signal is, there is a separate source of signal, and whichever signal after interacting with your object which got reflected or transmitted is what we are seeing there. Or there could be an instance where the object itself is emitting some signal. Okay. For example, some nuclear material, nuclear reactive material has been injected into the body that transmits the signal. This is also used. So majorly these three will cover for most of the signals that most of the imaging modalities that we see. And again, I'm sure that most of you are aware of this electromagnetic spectrum. As you could see here in this electromagnetic spectrum, let's start from where we could see. This is the visible spectrum. And as you move here to the right side, the frequency increases from here in the electromagnetic spectrum. That means the wavelength comes down. And as you move to the left here, this is where the frequency is reduced. So you could see here there is a visible light, UV light, X-ray light, and gamma rays. Then on the right-hand side of this, sorry, left-hand side of this, you have infrared light, microwaves, and radio waves. In all of these things, so as we said, our our vision system is sensitive to visible light. So that's why we acquire these images usually through reflection or transmission. For the light, when as long as the objective objects are sensitive to this visible light and the size is within the limits of what our vision system is designed, we could see that. But in medical imaging, it's not only the visible light that you could use. Otherwise, we want that has to go inside the body and make some sense there, right? So you have on either side of this spectrum of this visible light is used as well in medical imaging. For example, does anyone would like to make a guess on what is the kind of images that you would get in the visible light generally? So are the participants muted or can they unmute and answer?
Uh, Sir, they can only write in the chat box.
Okay. Yeah, sure. So in that case, I'll go ahead because in the interest of time also, maybe I'll go ahead. But at the end, let's have some time to answer your questions. Okay. Yeah, good. So here, if you see it, endoscopy, some of you might have heard where they will send a source inside, a light source inside, a camera and a sensor, which is sensitive to that, falls under endoscopy. And CT and radiography. These are digital radiography is what we typically call as X-ray, but CT also uses X-rays. So this comes next here. And then nuclear imaging comes as is even having further high frequencies. And if you go to the low frequency part, it is in the radio waves spectrum that MRI falls into. So as I said now, you could see three principles, right? And so globally, one is reflection, transmission, and nuclear radiation. So here, in case of CT imaging and X-ray imaging, it is through transmission. So let's say there is an object and an X-ray source is there. As this generates X-rays and it might be going, it will be interacting with the object. And on the other side of this object, there is an X-ray, just like retina is sensitive to visible light, you will have a sensor on the other side, which is sensitive to X-ray intensity. So after whatever has the X-ray beam got attenuated, while it is passing through this object, the remaining thing, the sensitive, the this is sensitive to the intensity, depending from which you can measure what is the remaining intensity for that X-ray beam. That is how image is formed in what we call in what we in a layman's language we call somebody else X-ray scan. What it is essentially is radiographic imaging. And CT imaging again comes under one is this is called as projection radiography. And we will come to the CT imaging. You can see in the transmission imaging, this is yet another one which is typically called as computed tomography. We'll come to that shortly. Before that, let's go through the projection radiography. Again, projection radiography is a very generic term within which you will come across different equipment of X-rays, different machines. One is for whatever you undergo for routine diagnostic radiography. This is what in our layman's language we refer to as X-rays, fluoroscopy machines, and so on. Then there is another thing called as digital radiography. Earlier, if some of you might be knowing that the X-ray sensor used to be a film which is exposed to this transmitted X-rays after attenuation, and it is kept inside an illuminating setup and used to be seen. Now the film became digital these days. We hardly find out except in the old machines. So these are called as digital radiography. And even the blood flow can be estimated, and this X-ray can be done dynamically over time to see how the blood is flowing, how the artery conditions of arteries and other things are there using X-ray beams, and that's called as angiography. Then again, with certain modifications to the setup, one could study or one could have a look into the brain. So this is referred to these kinds of equipment, specialized equipment are referred to as neuroradiology. And then again, customization to these machines are there in such a way that these X-rays can be taken in, let's say, in ICUs as well, or in places where the patient cannot move, but we need to take the machine there, and those are mobile X-ray systems. And then there is another thing called as mammography. This is particularly for acquiring the images of breast in order to see or diagnose the breast cancer. It has a special customization to get effectively, in a more effective way, the images of the breast, and this is referred to as mammography. The point here is all of them falls under projection radiography, and all of them uses as a source X-rays. Okay, if we go little more into the history of this, so thanks to William Röntgen, I'm sure most of you would have studied this in your 10th standard or in the high school, where he happened to accidentally discover them in 1895, and that is one of the we could say the first breakthrough and very, very important breakthrough in medical imaging. So one could assess the significance of this breakthrough by looking into the timelines. For example, as you could see here, 1895, that's the photograph of their marriage ring of his wife. Within the same year, first medical imaging X-ray was published. Clinical use within 1 year it has come, and within next 5 years, first Nobel Prize in Physics has been given for the discovery of X-rays and development of this X-ray images. Okay, so this is also referred to as, another name to it is planar radiography, because you will get a 2D image of a 3D object. This is important. Make a note of this. Will be useful for us. Again, we will come back to this point while we discuss about CT imaging, right? And it will be fun to know people were able to see things inside. It could, and initially they have no idea on what would be the right applications to look at. The initial ideas were what you see here for shoe fitting fluoroscope, they used to call it, and they would say to the customers that we would give you a customized shoe by analyzing your feet, and you could see all the kids and everything. It was more of a fun in the beginning, where they could get the skeleton of how the bones and all are there. And very soon they realized that people got sick with this radiation exposure. They realized that this is hazardous, and then they have learned over years, they mastered what are these X-rays, how to limit the dose, and how to make useful images safely than any of these applications. So as I said, the left side image that you see here is how the initial days the acquisition used to be. You could see they are kind of heavily guarded with all these things. So it took the other extreme, and over the time they mastered, and yeah, all in terms of how to handle this, and you hardly see anybody standing there unlike here, and the doses also have come drastically, and this is how these days digital radiography would look like, and these films have been replaced by a digital film here. Right. And again, as I said, I'll just show you some glimpses of these pictures of how this equipment looks like, so that if you happen to come across any of them, you would realize that this is what you already have some idea about and how it works. This is called as CT digital angiography, where they would study how the blood is flowing by taking repeated X-rays over a period of time. And this is a mobile X-ray system that you would hardly, with the variations from company to company, you would see them sitting in ICUs. And this is the mammography system, which is kind of customized and designed such that a very good quality of breast images can be acquired for the diagnosis of breast cancer. Okay, so that's a bit of story about X-ray images. And as you could see, that for the first time, we as humans could look inside the body without cutting it open, thanks to digital radiography, right? Still, there is a problem here. There is still a problem here. We are getting only a 2D projection of a 3D object. So the next subsequent obvious logical question would be, can I get a 3D itself? Because let's say there is a tumor spatially somewhere in the three-dimensional space, it can only X-ray can only help me at the most to see where exactly in this 2D, if I just kind of put everything onto collapse everything onto this 2D plane, where exactly where along which line is the problem is at the most it can tell. So now the question would be, how can I construct a 3D image from these projections? So what CT does is it takes multiple projections from different angles of the 3D object, and then it reconstructs the 3D image. It reconstructs the object or the person here in this case in 3D. So essentially, it's a very classical inverse problem where you have multiple 2D projections of a 3D object from different angles. You know the angles because we are the ones who are rotating it. And how do you reconstruct a 3D object from multiple 2D projected images is what CT attempts at. Okay, and two important personalities here are Hunsfield and Cormack. Hunsfield is the one who has come up with the equipment CT machine, the first CT machine, and all the mathematical framework on regarding when I have multiple 2D projections of a 3D object, how do I reconstruct the 3D object has been given by Cormack. Okay, so you could see here, this is what I mean by multiple 2D projections of a 3D object. So, well, here you could think of it as you can also bring it down by one more dimension. So, if we are interested in just constructing one slice of the brain, let's say. So, the one slice, the moment we consider it as a slice, you can ignore the thickness, you could consider it as a 2D object. Now, through that, if we project the X-ray beams on the other side, you will have, as you could see here, this part is the detector part, this in green is the source part. So you will have 1D projections of a 2D object. Now you have multiple 1D projections of a 2D object, and how do you reconstruct? If you are able to do it, one simple setup is you come down and at each different values of Z, let's say, one can construct a slice wise information. Okay, so again, as I said, Huntsfield, 1971, he has constructed it, and before that itself, many tens of years before itself, Cormack has developed the mathematics for it, and again, this is another landmark one in medical imaging. Within 8 years of the first constructing the first CT image, they got the Nobel Prize. This is to highlight the significance or importance of this contribution. Okay. Now, these days you will find these CT scanners almost in every reasonably big village to town cities and all. So this is how the CT image would look like. This is referred to as gantry. What it had, this is the referred to as couch, where the patient will be laying down and he will be moved stepwise into this. At a given step, it's the 2D image that has to be reconstructed. Within that, there is a rotating X-ray source as well as the detector. So at different angles, the 1D projections of the 2D object, you can think of it is taken. And since it is computed now from all these 2D, 1D projections, a 2D object, this is referred to as computed tomography. Okay, so if you recollect the earlier slide, that's where we were talking about one is projection radio, planar radiography. This is not, so you are having 3D object in a plane itself. Now this is also referred to as computed tomography. So this is what I would say about the CT. We are not going into the mathematical details of that, given the constraints on the time. Nevertheless, I'll give you the relevant references shortly. Okay, so with that, now let's move on to magnetic resonance imaging. This is again another, the third breakthrough, if we have to tell, very important breakthrough in medical imaging, if we have to say, That's this MRI. You all would have heard as MRI, magnetic resonance imaging. So if you notice in the earlier two, both in digital radiography and computed tomography, it is done with the help of X-rays. So that has, which is having high frequency. Because of that, there is a radiational impact. So there is a limit to how many of those X-rays you could take. Not only that, the resolution that you get, the contrast you get is good for some structures like bones. But for example, if you consider the brain, the soft tissues within those soft tissues, it's very hard or almost impossible to get the contrast of these soft tissues like what you see in MR imaging. The very important aspect of MR imaging is that there is no radiation effect here. So hope you remember the source here in the electromagnetic spectrum for magnetic resonance imaging is radio frequency waves. But it's not like you send radio frequency. The principle is very different from what we have seen in projection radiography and yeah, in the last two modalities of images. We'll see again, just to give the importance of it. This is a result of developments, discoveries, inventions happen in multiple interdisciplinary domains or cross domains. For example, in discovery of nuclear magnetic resonance phenomena in 1945, and there is something very close to MRI is called as nuclear NMR spectroscopy, where they would find out the decompositions of a given chemical. That's 1963. Again, this is another Nobel Prize that's also laid its roads for this to appear. And then, of course, making that MR image scanner by Paul Lauterbur and Mansfield in 1973. And then one more important thing is when we say MR, it's not just one imaging modality. Within that, there are so many different ways of acquiring imaging. For example, standard MRI, echoplanar imaging, spectroscopic imaging, diffusion weighted imaging, functional imaging. There are so many variants depending on how the image is acquired. So for the next 5-10 minutes, we'll go through how MR system works. So before we go through that, let me take you through the key components that are there in an MRI system. So you could see here, first thing I want you to make a note is there is a very high magnetic field is there, into which the patient or the subject is kept. And in addition to that, a variation in magnetic field is applied through these gradient coils. Okay. And this is the second important one that I want you to make a note. And then using the nuclear magnetic resonance phenomena through applied magnetic field, there is some frequency to which it is now, it could resonate. And so there is at that particular frequency, there is a radio frequency transmitter and there is a radio frequency receiver. And which part of should either transmit or receive is controlled by a radio frequency coil. And then, of course, there is an algorithm to be run, there is a reconstruction algorithm to be done, and some protocols from which one has to choose. So these are essentially the major components. There are again few more components, but these are the major components of an MRI system. Now, hope these components are clear to you, but now given that, we'll try to understand how you are going to get an image. And now, what is it that is responding within the body for these radio frequency waves and the applied magnetic field are these atoms of hydrogen that are there within the body. So if you take a sample or some region of it, when no magnetic field is applied, each of these atoms are rotating at a particular speed, but in its own orientation. So each one, since it is rotating here, an electron is there. For example, you consider an hydrogen, electron is rotating at a speed. So it generates, because there is a rotation here, it generates magnetic field. But given that they are all in random directions, the net magnetic field happens to be zero. Now, suppose the same sample is kept under very high magnetic field. So this high magnetic field in terms you could say around, let's say, 7 Tesla, 5 Tesla, and I would leave it to you as an exercise to figure out how much 7 Tesla mean to typically compare to what you feel with a small, let's say, frizz magnet. I leave that exercise to you. Just try to find it out from the net. But very high you for now you take it for granted that 5 Tesla, 7 Tesla, very high magnetic field is applied. So when this is done, what happens is each one keep rotating at the same speed, but now they align either parallel or anti-parallel to the applied magnetic field. This is what it would happen. So intuitively, if we do not go through physics, we might come under conclusion that all might be aligning with the applied magnetic field. It doesn't happen like that. Approximately half of them would align parallel to the applied magnetic field, and half of them would align anti-parallel to the applied magnetic field. Again, this all comes under magnetic resonance phenomena, for which a nuclear discovery of that phenomena. So this has all physics related to that. Okay, so again, these 7 up and 6 down, let's say. Again, this number is slightly inflated. Out of 1 million, it will be hardly 20 in case of hydrogen, and given 5 Tesla is applied, let's say, will be hardly 20. But for us to first get some idea about how it works, you can think of it this way. When a high magnetic field is applied, let's say 7 of these electrons go parallel, 6 will come anti-parallel. What it means is there is a slightly more electrons that had oriented themselves parallel to the applied strong electromagnetic field. How much is the difference between this parallel and anti-parallel? Depends on this factor also, along with few other ones. Okay. So, well, then how is this going to help us in getting an image? Should be something going in your mind. So what it is done now is, so just to give some animation here, as I said, when you apply here a very high magnetic field in this direction, you could see that so the magnetic field is in this direction. So at that time, slightly more, sorry that this I had to borrow from internet since I don't have my own animation, but pay attention to when it comes in the next round. So as I said, if the magnetic field is in this direction, initially there are more atoms, as you could see right now here in the low energy, so which is parallel to the applied magnetic field, is having relatively in a low energy state, because if somebody has to align with the force, it need not have much energy. But if it has to go against the applied force, that is where you need a high energy. Just for a visual, for an intuition, you could think like that here. Now what will happen is it actually resonates a particular, if you make all these calculations, at what frequency is it rotating or resonating, comes under the range of radio frequency. Now what will be done is that through an external coil here, you apply, you give that energy required, such that this packet, again, it requires the understanding of quantum physics, tells us that at this resonance, whichever is resonating at a particular frequency, if you transmit pulses which are at that frequency, they absorb that and they go into high frequency. Now what will you do? This is only a temporary excitation that one has given. Now you withdraw the RF coil excitation that you are giving. And this is just in the spur of this it has acquired, but it cannot stay there for too long. So what it does now is it emits now those additional packets that it has absorbed and comes back to its low energy state. So this is where it actually emits a radio frequency signal. Now, at what time till it is emitting after absorbing this pulse, and at what rate it is falling also, and how many have kind of moved from low energy to high energy and then came back to low energy, will tell us about how the molecular structure at a given position, which is now under this whole setup is there, will dictate. So that is what, by analyzing this received radio frequency signals, one can infer the structure, but it is there. Just like in X-ray beam, in digital radiography, planar radiography, and CT, by looking at how much got attenuated, we are able to see which structure is there at a given location. In similar lines, here, by looking at how fast it is decaying, it is moving from that anti-parallel state to coming back to parallel state, and how many for how many molecular proportion, this is percentage of molecules, this is happen atoms, it is happening. We could say depending on the structure, this is depending on not only the atoms but the atom, how they are tightly bonded, and all the chemistry comes there. Based on that, we could say what is the signal there on the MR. So now again, let's come back to this figure. As I said, very high magnetic field is applied. Usually superconducting magnets and all these things can come here. Static field will be there. Now you don't want the signal to come throughout the area. You want now this, the resonant frequency is dependent on how much magnetic field is there at that point, and you want the signal to come from a specific location. That means you need to kind of vary this magnetic field spatially, so that the radio frequency signal you give is proportional, which is under resonance, only that will respond, so that you can pinpointedly get response from a particular location. In order to do that, on top of this high magnetic field, the field is varied spatially, and these are called as gradient coils, which will be there in x direction, y direction, and z direction, so that you can figure out which kind of material or tissue is there at a given point. This is under your control, and where to apply and how to apply, and which frequency to transmit from here, and then you receive from here, from that. So this is for this purpose gradient coils are used here. So this is about the MR imaging. Again, as we said, very high magnetic field is there. Even recently, few months back also, there were cases of unfortunate deaths where enough measures haven't been taken there. For example, somebody was taken with the oxygen cylinder. It's a very high magnetic field, almost 200 to 50 times more the strength, more than the strength of what you see for a fridge magnet kind of thing. Okay, it's a very, very powerful thing. So people have to be extremely careful while entering there, not taking any of these metallic things inside, or so a proper coordination should be there. So this is just to highlight this aspect of MR imaging. Other than that, there is no radiation in that. This is how an MR scanner looks like. And reconstruction has many similarities to what you have seen. The reconstruction algorithms have a lot of similarities. The initial developed algorithms have a lot of similarities with what you see with, yeah, CT images. But again, acquisition, as you could see, entire thing is dependent on RF signals. Okay, so if I have to say here, at its core, most of the times what happens is students, when we say that the course is offered in medical imaging, they would see this is something to do with medicine. But actually, to develop all these systems, the a very profound understanding of signals, systems, image processing, and then to make these material image, to design that and develop that medical instrumentation, are more important components than knowing the medicine, because here the goal is how do I acquire an image. The medicine part comes into the analysis of that image by a doctor, is what medicine can come. But here it is very important to pay attention to the point that it does require lots of more engineering than medicine. Another thing is it's multidisciplinary area. If it's not enough, if one is good at, as you could see, it is a confluence of so many things. One has to know a bit of physics, understanding should be there, good mathematical understanding should be there, and at the end of the day, these are signals. So the very profound understanding of digital signal processing is also signals and systems and all these things are also required. Again, this is by no means will make you a kind of reasonably well aware of how it works. This is just like a not even a trailer. You could say it as a teaser than a trailer. So I had, yeah, I think back in 2018, if I remember correctly, was offering this course. So later years, although it is offered, it is not there online, but this is the course that is available online. If you are interested, you can go through this course. Yeah, this essentially has 5 modules. I will share this. Yeah, you can look into, you can Google my name also. There you will get the web page. And in that, if you go to teaching part, we'll have link to medicalimaging.html. The whole course is divided into 5 parts. So this is where I would talk in general, digital X-ray images and other things will come here, but it gives you an introduction to, for example, I want to work in medical imaging. Where do I get different data sets? What are important challenges here? So all the, and which are all the tools that are available there. What are different kinds of modalities and all this. These 8 lectures will talk about that. And image processing plays an important role. Then, yeah, there are about 10 lectures, 10 to 11 lectures are there on some basic image enhancement techniques that one should know to deal with these images. And again, as I said, signal processing background will help you a lot. Okay, so definitely it is required if you want to understand how these images are acquired and how they make sense and all. So then there are around 8 lectures are there on doing its enhancements in the frequency domain. Then a bit of how do you, as I said, from multiple 2D images, 3D is reconstructed, or from 1D, 2D is reconstructed. So how do you do that reconstruction in CT imaging? I have a 4 lectures given on that for CT image reconstruction. Then, as I said, one should understand a bit of physics and then signal equations and its interpretation and so on and so forth. So there are around 7 to 8 lectures on MR imaging. I would recommend you strongly to go if you are interested, go through that, and I'm sure it could help you. As I said, if you again, I cannot overemphasize this fact that if you plan to work in the area of AIML for medical imaging, it's not just enough to know either medical imaging or the AI alone. We cannot see the domain knowledge. The same thing applies to computer vision also. If there is some applications that you are applying, domain AI ML are never a substitute for domain knowledge. So one should be good at both. Then only you can come up with good algorithms that can kind of will be useful for the specific applications in practice. So maybe I think it's 6, so I will stop here. So we'll take up questions for the next 5 to 10 minutes, how whichever time is there.
Yeah, thank you so much,
Yeah,
sir. Thank you so much, sir, for your insightful and informative session, sir. This will definitely help the participants to at least uh, get some idea about medical imaging modalities, and they will definitely learn what are, I mean, how these medical imaging technologies, what the working principle behind it, and how it is being captured. Although there are a lot of physics involved in it, but still, at least the
right, right,
outputs are images, right? So that we are interested in analyzing those images. But you have explained nicely, sir, the physics concept also. I mean, you have summarized it nicely. We've got a lot of information from you. So now I request
thank
the
you.
participants to ask few queries if you have. So you can just write your queries in the chat box. Sir, you can directly look at the chat box and
Yeah, so I opened the chat is with me. I can see your questions here and try to answer if I know the answer.
yes, sir, absolutely.
Yeah, any tool to open .nia images, very good. That means he is someone who is working already in this area. So I typically use ITK Snap, very simple use tool to begin with. So one thing I would say is you look at ITK Snap, and again there are so many tools for it. For example, and again in I had one lecture almost dedicated to this in the medical imaging course I was talking to. For example, 3D slicer, that's a monster where you have so many filters already made available there, which you could kind of put them together, make the entire pipeline, give input, and then see at each stage what the output that you are expecting and getting, that will work. So, and again, these days, Python, because PyTorch and all, these are the tools that people are using. They also, you could open them, but opening means it just loading there. But if by open, when you are asking it, if your question is about how to visualize it, I would say easy tool is ITK Snap. Start with it, and then there are n number of tools. More than I won't be surprised if there are more than 100 tools to do that. But I usually use ITK Snap. Very simple to use, and you could do some basic things like active contour based segmentation, so on and so forth. So that's the answer for Anita Rani. And yeah, so can you tell us about medical image formats like DICOM, Nifty, also how to deal with them using Python and how to visualize them? Very good question. See, first of all, people will, the first thing that our students try when they are doing some project in medical imaging is to convert, how can I convert those images into JPEG? First, it is important to understand there is a reason why these images are given in diagram format. The reason being, there is a lot of additional information associated with the acquisition of that image, including the parameters used during acquisition, which will be lost the moment you look at only image. That's one reason. Second, very important reason is, I'm sure many of you know what is the range of intensities that you could store in a JPEG image. JPEG, if it is a color image, you have RGB, three channels. You can write one of you in the chat there. Any idea on how many, what is the range of intensities that I could store using a JPEG file? Is only 256 because it uses unsigned character as the one to store there. 8 bits, it uses 8 bits. So 8-bit means you can store from 0 to 2 power 8, 256 distinct values only it can store. But on the contrary, you want to have a very good resolution. That means 8 bits are not enough to store the actual contrast, and the moment you are converting a given image into a JPEG or PNG or TIFF, you are already sacrificing the image resolution in terms of distinct intensity values. You are sacrificing it, and that's undesirable. That's the last thing to be done when you are dealing with images. So nowadays, all there will be simple package that you need to load at the beginning. ChatGPT and all these tools also can help you to type the same question there, asking it in very detail. And this is what I am using. Let's say Python I am using. I have a DICOM file. I want to load this image. What are the packages to include? Give me a sample code. That will answer. That will even give you the code for doing it. And as I said, the important thing to make a note is don't rush towards don't rush towards kind of converting that to JPEG. Make the best use of the already existing information. Okay, good. So hope that answered the question of SVD. I don't know exact name that was there. So next one is Dr. Suchitra Sucharita Jackson. She was asking, is ultrasound imaging is better compared to CT for lung disease analysis? Ultrasound, can we use ultrasound imaging? Well, so again, in this whole thing, we unfortunately could not touch upon ultrasound. This is based on the sound also, based on whatever you get back And once you send an ultrasound, it doesn't fall under the electromagnetic spectrum. From there also you can get it. And yeah, whatever has been left after going through, getting absorbed and returning, from there you will do the assessment of it. That's what ultrasound imaging is. The good point with ultrasound imaging is that it doesn't have a radiation effect, unlike CT. Let's see first the advantages of ultrasound. Second advantage of ultrasound is very inexpensive. These are two, and very portable. You can put it in the pocket and take it away as well. So that's what it is there. However, it has its own limitations. For example, the moment it comes across bone, it is just absorbed and nothing almost comes back there. So that is where wherever there are bones, you can still do some imaging of lungs by letting these waves go through, let's say, in between, what do we call, the skeleton that we have in between the ribs, it can go and get it. But the quality wise, it is not on par with it. Okay. And again, if there are doctors here in this group, and if I say there is a lot of noise in ultrasound, they don't like to say that as noise, because it is also a signal for them in some way. So for us, to make any sense out of ultrasounds and develop algorithms to doing that is more challenging. And one more thing is, unlike CT images, the images that you get are operator dependent, how he is moving his probe and constructing the entire image. So these are the pros and cons. So once these challenges are addressed, there are the pros one could leverage from that. Hope that is answering the question about ultrasound imaging better compared to disease analysis. Again, yeah, most of the times I still usually could see, to see the growth of the baby, they use ultrasound because there are no bones there. Those fluids, the attenuation in fluid is very negligible there. And then it is also used for lower abdomen parts to see how various parts, for example, are working there, and also the kidneys part they will see. Okay, so those are the places where ultrasound is good. Here, people usually would go, if digital radiography is enough from 2D. In some special cases, they go for CT. Hope that answers. And then the next question is M. Abdul Karim. Is there any specific tool available to meta-analysis using multiple imaging data? I'm not sure what you mean by meta-analysis. There is a meta-imaging data here. So again, I'm not sure of what you exactly mean by meta-analysis there. I'm not aware of that. The next question is Suman Rekha. Any tools for brain parcellation for MR images for Alzheimer's disease? So many tools are there. Again, please go to some of the tools I was talking about, the brain in particular, in the videos that were there in my medical imaging course. Ultrasound, someone is rating, ultrasound is not good for air bubbles, which are the main constraint of lung image. Well, air bubble doesn't cause much of a problem because ultrasound wave can go through that. It's because of the bones that causes a problem. Then Surya, sir, does creating own medical data set give advantage in research study? Yes, very much, because it also depends on the applications. For example, if you are working on X-ray imaging, let's say there is 1 million chest X-ray data set is there. But again, having said that, demography changes from place to place. It's not just creating medical images is good enough. If you could get annotations for the data set also. Annotations, what do we mean by that? Is, for example, there are 4 or 5 abnormalities like pneumonia, earlier COVID. There are so many other things are also there. Which one is this image corresponding to? If one is able to do that, or they want to segment some parts, if one could get such data set of annotations also, it's really advantageous and very valuable. But the catch here is, you should get an expert doctor, his valuable time, if you could afford that. And if you are doing it on such a data set where there is not significant number of data sets which are kind of captured and made publicly available for that particular rare abnormality, it will be of great value. Okay, so next question by Dr. Hardan Chel is which tool is better for annotations of 3D MR or 3D of city images, ITK Snap or OpenCV? It's a good question. Again, we tried doing this earlier. There is no single tool that is very good for that. We in fact used ITK. Each one has its own pros and cons. We were using for some time ITK Snap. It does very well, reasonably well. And you could again find so many tools. The one 3D slicer I was mentioning also does that. And there are many other tools. It is more of how quickly or which tool that particular person finds it comfortable with. That's how you could look at. OpenCV as such doesn't have, I am not sure if it has it, but there could have been some tools that are developed in OpenCV. As I said, it sometimes one challenge we had was we even had to store the annotations that we did into a DICOM file. So that was a bit of challenge. Might be not all applications demand that. You could simply get an image and on top of it, if you are able to store that, it is good. And again, we faced quite a few troubles playing with this offset values because in that image information, in the meta information that is there, this information will be there in some point of time. So that has to be correctly applied to those things. But again, it's just matter of a time. You stay with some tool for sufficient amount of time and try to figure it out. I'm sure there you will find. Again, each one of you may find different tools more convenient. As I said, 3D Slicer does that. But as I said, acquaintance and usability of that to start using it would take some time. But later, that each has its own pros and cons. Okay. So as far as I could see, those are the only questions. Did I miss any question?
No, sir, absolutely. You have answered all the questions. So thank you so much once again, sir. And you have
My pleasure.
rightly point out the important tools to analyze the images. I mean, other than OpenCV. So
Right.
thank you so much, sir,
Yeah.
once again.
Usually OpenCV is good for computer vision applications,
True, sir.
but when it comes to medical imaging, I would say you go for other kinds of tools. There are many other specialized tools for medical imaging, starting from as simple as ITK Snap. That's how I'll put it.
Yes, sir. Yes, sir. So thank you so much, sir. And we'll look forward to your second talk, I think on 5th May. Uh,
Right.
so
Yeah. Thank you all. Thank you very much for the wonderful questions. Made me feel excited looking at all these questions. And it's a pleasure for me to take part in this wonderful workshop that has been made very well kind of structured. Thank you all.
thank you so much, sir.
Yeah, bye.
Yeah, participant, we will start the next session just